Hello everyone, my name is Emma. In this video I will be talking to you about pericarditis. Peri, meaning around, cardium, meaning heart, and itis, meaning inflammation. So what the word basically stands for is around the heart inflammation. In order to understand pericarditis, we need to get a closer look at the disease. We have to look where it occurs in the body, the heart. This is what a normal person's healthy heart looks like. If you look closely, you can see a thin lining around the heart. This is called the pericardium. The pericardium is a membrane that encloses the heart. There are two layers to it, and it holds the heart in place and helps it to work. This is a heart with pericarditis. The pericardium is now inflamed and filled with a small amount of fluid, which separates the two layers so there is no friction between them anymore. There are several types of pericarditis. Some include chronic pericarditis and acute pericarditis. Let's take a look at the statistics. For acute pericarditis, 3.32 per 100,000 people are diagnosed with it in the world, and is 2.02 times higher in men than in women in the total population. According to Omics Online, approximately 600,000 people have pericarditis in Canada. Symptoms. Symptoms for pericarditis include chest pain. This is common in about 85 to 90% of people with this disease. The pain begins in the center of your chest and can work its way to your neck or upper back. The pain is sharp and stabbing and can be mild or very severe. It can either come gradually or suddenly. For people with pericarditis, it may hurt to take a breath, and for most people who have it, they feel worse while lying down. More symptoms include fever and chills, sweats, shortness of breath, and difficulty swallowing. The cause of pericarditis is often hard to determine. Sometimes this disease can develop shortly after a major heart attack or heart surgery. However, in most cases, doctors are usually unable to find a cause, making it idiopathic. The most simple treatment for pericarditis is rest and non-steroidal anti-inflammatory drugs, which can be prescribed and sold over the counter, such as ibuprofen or aspirin. Surgery is an option, but usually as a last resort. It's usually reserved for people who don't respond to any other treatments. They can drain excess fluid surgically or with a catheter. Biotechnologies. Testing usually includes an electrocardiogram or an EKG, a chest X-ray, an echocardiogram, an ultrasound of the heart, or MRI. Complications can arise due to pericarditis. Constrictive pericarditis, uncommon, permanent thickening, scarring, and contraction of the pericardium. The pericardium loses much of its elasticity and resembles a rigid case that's tight around the heart, which keeps the heart from working properly. Another complication is cardiac tamponade. It's when too much fluid collects in the pericardium. Excess fluid puts pressure on the heart and doesn't allow for it to fill properly. That means that less blood leaves the heart, which causes a dramatic drop in blood pressure. Cardiac tamponade is dangerous and can be fatal if it isn't promptly treated. Thank you for watching.